Hello. Good evening, friends and loved ones. Thank you very much for your time. Yes, we are about 10 minutes late because we had to listen to our president give his nation's address. Yes, so today we're going to talk about a very interesting condition, as we've been doing in the previous weeks. Yes, thank you very much for staying tuned with us in the subsequent weeks, in fact the previous weeks, and I'm sure today will not be an exception. Very interesting, and we'll learn a lot from today's discussion. Yes, okay, so today we're talking about a condition called rotator cuff injuries. Rotator cuff injuries. Today's topic is rotator cuff injuries. So we begin in the name of the Father and the Son and the Holy Spirit. Thank you very much. Okay, so the outline of today's presentation is that we're going to talk about the definition of the condition, the anatomy, the etiology, that's the cause, the clinical presentation, that is the symptoms that result in this condition, the causes, the risk factors, the complications, the differential diagnosis, how to differentiate this condition from other similar conditions, and then diagnosis procedures. We can talk about outcome measures, talk about examination, how we can diagnose this condition specifically. We're going to talk about the medical management, the physical therapy management, lifestyle modifications, how we can modify our lifestyle to prevent this condition from recurring. And then also we're going to talk about the precautions, and then I'm sure we'll come to a successful end. Okay, so one may ask, what is rotator cuff injuries? There are three words coming together from this condition. Rotator cuff injury. Rotator means it could be a rounded region of the body, and a cuff is due to the location of where it's found, like a cuff. And an injury is where you have deformed part of the body, so probably through an accident, through a trauma, through so many causes. Okay, so we're talking about the condition rotator cuff injuries. So a brief anatomy of the condition is that rotator cuff injuries, they are injuries that affect the shoulder. So it's around the shoulder region. This is my shoulder. Yeah, so any injury around this structure, around this region of the body, could be classified as rotator cuff injuries around the shoulder region. And the shoulder comprises of muscles in front, at the side, and at the back. Okay, so the front muscles are called anterior deltoid muscles, and then the side is called supraspinatus muscle. The back is called the posterior deltoid muscles, and there are other muscles also that are in the shoulder that are under the armpit region, called the teres minor, and then at the back of the shoulder we have a bone called the scapula. Inside the scapula is called the infraspinatus. So the rotator cuff muscles comprise of four different important muscles: 1 supraspinatus, 2 infraspinatus, 3 teres minor, and then the last one is subscapularis muscles. Okay, so these muscles are very, very important, and any distraction or any injury to these muscles or their other structures that connect them together could cause rotator cuff injury. Okay, so in anatomy we talk about structures, and then we have structures such as the arm. We have the humerus. The arm bone is called the humerus, and then the backbone is called the scapula. It's around this region. And then we have the head of the humerus, and then we have the collarbone. Okay, so these are very important structures that help us to identify this injury. And then in the arm bone, we have a head of the arm bone, that is the humerus bone, called the head of the humerus. It fits into a socket around the side called the ball and socket joint. So after this presentation, there'll be so many pictures to appreciate this condition. It's called the ball and socket joint. So the ball of the head of this bone fits into another bone called the scapula to form the ball and socket joint. And then in this injury called rotator cuff injuries, most of the injury is due to injury to this part of the muscle called the supraspinatus muscle. So supraspinatus muscles are mostly injured when you come to rotator cuff injuries. So at least people will say, or at least most are commonly blamed to be affected in this region. That is the supraspinatus muscle. Okay. The other structures in the shoulder we can have the muscles, we have tendons, we have ligaments, we have the joint capsules, we have cartilages, so many things. And then without these things, the ball, that is the head of the humerus, cannot stay inside the shoulder. It will come off. If you see someone's shoulder coming off, scientists say subluxation or dislocation, that means that the structures around that side are not so strong. Okay, so these structures are very important to improve the stability of the shoulder joint to fit into the socket, and this helps also to keep the shoulder in place. If they're unstable, they prone or they predispose the shoulder to injuries, and then they cause a lot of problems, such that the shoulder joint, that's the humerus or the arm bone, could come off the shoulder in and out continuously, and this could be a very, very disastrous, very, very disastrous. So we have so many kinds of rotator cuff injuries. We have two types, mainly two kinds of rotator cuff injuries. The first one is the acute type, and then the chronic type. The acute type comes in the form of a twang, that is a description of how it comes about. We also have a snap, so we have around the shoulder joint. It could also mean that one of the rotator cuff muscles are injured. Another one is called a pop. So as you raise your hands up or you do any activity, you hear pop. It means it's likely that one of the muscles or the structures they are injured, and this could be classified as rotator cuff injuries. Other structures there are bursa, which is a sac, lubricated sac, which helps to prevent contact of muscles or tendons and prevents friction in structures. Okay, so we are talking about rotator cuff injuries, yes, and we have so many forms of rotator cuff injuries, but we have three main forms of rotator cuff injuries. The first one is called impingement, where you have the nerve impinge into the shoulder. So it could be that the nerve is pressed on by another muscle or a bone. This is called impingement. And then we have irritated, where we have the bone rubbing against a nerve or muscle rubbing against a tendon, and this could cause an injury, either acute or chronic, of the rotator. Also, we could have a tear, where we have trauma or overuse injury that could cause tears in the shoulder region, one of the muscles there, and this is called rotator cuff injuries. So there are so many causes of rotator cuff injuries, but mainly we have repeated overhead activities, such as painting. So the painter will be painting this way as he's raising his hands up and down. It could cause wear and tear around the shoulder region, and this could cause rotator cuff injuries. Or a carpenter who has been hitting against an object, and this could also cause rotator cuff injuries. There are so many instances, and also we have one also cause of rotator cuff injuries, such as that is aging. That's so as we grow old, our structures don't tend to have their maximum or the peak strength, and therefore they are predisposed to tears and micro tears and small tears, and this could result in rotator cuff injury. Another is a direct trauma. So when someone blows your shoulder, it could injure the person falls down on the shoulder, engaging in sports such as wrestling or boxing. This will cause rotator cuff injuries, and this could have associated with the collarbone separation injuries. So when the collarbone separates, it could cause injuries. We have one such as Erb's palsy could have some form of rotator cuff injuries. And then we have dislocation of the shoulder, where the shoulder comes up the joint. This could also cause rotator cuff injury. How or what are the symptoms of rotator cuff injuries, if one may ask? The first one is the person or the patient experiences a dull ache deep in the shoulder. He feels a dull aching pain deep in the shoulder, and this could present itself as rotator cuff injuries. Also, the person has disturbed sleep. The person cannot sleep well. The person wakes up in the midnight complaining of shoulder pain around the shoulder, and then this could further be diagnosed as through other tests as rotator cuff injuries. Also, the person has difficulty in combing the hair. So when the person tries to comb the hair, the person has a lot of pain around the shoulder region. When the person tries to put the hand behind him or reaching something at the back or scratching the back, the person complains of pain in the shoulder. Also, this could be accompanied by weaknesses. This could be the person raising their hands up. The person has difficulty in raising their hands up. This could also be a cause of rotator cuff injuries. So after the symptoms, we will ask, what are the risk factors for someone to have rotator cuff injuries? 1, the age. So if you are 60 years and above, research shows that you are likely to have a rotator cuff injury. Also, involving activities such as construction jobs, painting, carpentry jobs could predispose you to have rotator cuff injuries. That's one major risk factor. And also a family history. So if your parents have rotator cuff injury or shoulder injuries, you could also be in line to have this, and this could also serve as a watch for you to not to have it. So after the risk factors, we will talk about the complications. What are the complications of rotator cuff injuries? First of all, 1, there could be permanent loss of motion. So the person cannot raise their hands again due to rotator cuff injury, due to severity of the pain. Also, there could be progressive degeneration. That is, degeneration means loss of the tissues, that is especially cartilage around the shoulder joint, and this could cause severe pain. And then one major important point is that prolonged immobilization, that is not moving the shoulder because of the pain, could cause another condition which we've talked about already as frozen shoulder, and this is a very painful condition. So how can we diagnose this condition as frozen as rotator cuff injuries? As physical therapists, we have various tests that we carry out. One is a near test, and another one is an empty can test. You just turn a hand in like this. So if the patient complains of pain in the shoulder, it could be as a result of injury to one of the rotator cuff muscles. As we mentioned earlier on, we have the shoulder resistance test. That is, put the hands here and raise the hands up like this or like this. The patient complains of pain around the shoulder region. It could be as a result of rotator cuff injury. There are also palpations. So so sorry for the inconvenience. So we are continuing a discussion on the topic rotator cuff injuries. Is a short break. We're talking about the condition, the symptoms, the risk factors, complications of this condition, and then before we're talking about the diagnosis of the condition called rotator cuff injuries. So how do we diagnose this condition? We talk about the fact that we use special tests. We have, as physical therapists, we have special tests that we go through with the patients. One is called the NIES test. Also, we have the empty can test, we have the shoulder resistance test, and then we have various tests called palpation. So we're going to check the patient's shoulder and then press against it. So the point where the patient complains of intense pain, Then we zoom in to treat it accordingly. We have various assessment procedures such as checking for the sensation of the patient, checking for the tone, and also we ask questions such as what the person does, what movement causes the pain, and then what movement doesn't cause the pain. Aside the diagnosis, we go through various investigations such as taking x-rays that helps us to see whether there's a fracture at the region, that's the shoulder region. Also to see if there are any bone spares. Bone spares are bone growths near the shoulder that could impinge or press on a nerve around the shoulder, and this could cause rotator cuff injury. Also, we have other diagnostic procedures such as using the ultrasound. And the ultrasound is proven to be very, very effective because we can observe both shoulders at the same time to see if there's any abnormality or a mispresentation in any of the shoulders. Aside the ultrasound, we also have an MRI. An MRI means magnetic resonance imaging, and this helps to view the detailed structures in the shoulder. You can see the tendon, you can see the muscles, you can see the nerves, you can see so many structures in the MRI. But the only difference is that the MRI is cost effective, so we tend to shy away from it. But then it's the best actually in terms of diagnosing a condition such as this, a rotator cuff injury. Okay, so talking about the investigations, now we talk about the medical management. So as a medical practitioner or a doctor, how will you diagnose this condition or how will you treat this condition? The first is you advise the patient to rest the shoulder. A physical therapist also does the same thing, to rest the shoulder and then limit activities near the shoulder, and this helps to allow healing to take place on its own. Secondly, the use of non-steroidal anti-inflammation drugs helps also to minimize inflammation if there's any inflammation near the shoulder, and helps to minimize the inflammation in the shoulder and enables healing to take place very effectively. We also have corticosteroidal injections that are taken, or the medical practitioner or the doctor injects into the shoulder to minimize pain. Depending on the severity of the pain, the doctor gives injections there. And also we have platelet-rich plasma, that is PRP injections in the shoulder, and this also helps to minimize pain and then improve circulation in the shoulder. So when the medical management is done, we go through physical therapy. That's the second conservative method to improve strength in the shoulder and then also improve the daily activities of the person or the patient. So physical therapy involves so many things, but first of all, we are aiming at reducing pain, improving the range of motion, that is movement of the shoulder across a particular range. So if the patient can move the shoulder like this, we are aiming at taking a bit higher or to the maximum in the shortest possible time or in the best possible time. Aside the exercises, also we have various mechanical procedures. We have mobilization, we have manipulation of the shoulder. We also have electrotherapy, that is using of the machines in the shoulder. We have something we call trans-electrical or transcutaneous electrical nerve stimulation, that's a TENS machine, and this helps to relieve pain in the shoulder. We also have hot pack, where we apply on the shoulder to relieve pain and improve circulation near or around the shoulder joint, and this is very important for the patient. Aside physical therapy, okay, so let me mention other exercises that also we do. We also have, depending on the severity, if it's not so severe, we engage in range of motion exercises. We engage in pulley. So we take the patient the pulley and then you hold the pulley and bring it up and down, up and down, up and down like this. It's a pulley, it's a device called a pulley, which physical therapy used. In every established physical therapy unit, you should have a pulley to help to improve strength and range of motion exercises. If the patient's pain is not so severe or mild, we could go to a multi-gym where we have quite difficult exercises to do to help to improve the range of motion. Aside that, we have dumbbells, range of motion. Depending on the severity, we have the weights, so 1 kilo, 0.5 kilo, 2 kilos, to improve upon the strength of the shoulder. Okay, so aside physical therapy, when physical therapy is going through, or we go to physical therapist and there's virtually nothing to do, we then zoom into surgical procedures. And surgical procedures include two main surgical procedures. We have the arthroscopic surgery, where we have, in case we have a partial or complete tear of the tendon of the shoulder joint, we could have an arthroscopic surgery. That is, the surgeon goes to surgery to be able to correct the partial tear or the complete tear of the shoulder. Also, we could have open large incision, where we could have a very, very complicated rotator cuff tear. So when the person has fallen down in a very, very awkward manner, the person also goes through this surgery to be able to repair this damaged tendon. Okay, so I'm sure we've learned a lot. We've learned a lot from this presentation, and we'll be willing to share our ideas as best as possible. In a subsequent presentation, we'll give you a very, 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 very vivid explanation to the various health conditions. So today's topic is rotator cuff injuries, and various pictures will be followed on after this presentation. And I'm sure that we'll appreciate this very, 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 very well, looking at the pictures after this presentation. So we entreat you to visit the Facebook wall RICOY, and then we can have a very, very good understanding of today's topic. And I'm glad that we all have been staying along, though we had a little hitch, but thanks be to God, everything has really been a success. Thank you very much for staying tuned. Thank you for staying tuned. In the earlier on, I saw Mama around, I saw Fee, I saw so many people around. Thank you very much for your time. And then next topic is also a very interesting topic, and I'm sure that with this one we'll have a pictorial presentation of this topic, and then we will understand it better. Today's presentation didn't bring too much pictorial presentation, but I'm sure subsequent ones, or even after this presentation, we can see various pictures and appreciate them much better. Thank you very much. So the next topic is called whiplash. Whiplash is a syndrome that occurs in... Okay, so we'll talk about it the next time. I don't want to give you any clue, but let's stay tuned, let's stay glued to this time. So next week by this time we will be here again to talk about this condition called whiplash. So have a blessed evening, take care, may the Lord be with us, or have a blessed week, and may the Lord guide us and protect us. Thank you very much. Take care. So the next week's topic is whiplash. Have a blessed evening. Bye. Take care.